Good morning. It's Monday. So I don't know about all of you, but it is actually the last week of school. So I'm obviously driving to work as always. So it's last week of school. The youngest actually has his VPK graduation Wednesday morning. Last day is Thursday. I actually took PTO the morning of the graduation as well as on Thursday because we have some stuff around the house and some packing and stuff we need to do. And so all kinds of craziness happening. So it's going to be a very busy week. But got up this morning, did the HIIT workout. Those of you who are in the Faster Way with me, we all got to see the new studio this morning, which was awesome. It's very sleek, although we've been getting sneak peeks for quite a while, which has been exciting. I've been part of the Faster Way to Fat Loss for about 3 years now, actually coming up this next week. And when I started, they were actually filming in the CEO's living room. So it's come a long way, So it's been fun to watch the transition, and it's been entertaining. So anyway, getting down to business. What are we going to talk about today? So it's not the last Monday in May. Next Monday is. But seeing as next week is Memorial Day and I may or may not do any kind of live, I figured we would make today actually like the last Monday. So May is Mental Health Month. I don't want to focus so much specifically on what defines mental health disorders and what that looks like, as much as how it does affect your physical health, because we talk a lot about physical health here, but mental health is a big part of it. And I think sometimes people I think sometimes people feel like mental health is really, especially if you don't have a ton of exposure to it, they tend to think of it as, people with really severe depression, severe anxiety, some of the more extreme pathologies, if you will, bipolar disorder, schizophrenia, those kinds of things. The reality, though, is the severe pathologies are a very small portion of what actually makes up mental health. So major depressive disorder, even though it sounds severe, can be mild, and is very common, to be honest. We do at least once a year on every single patient, we do a depression screening called the PHQ. It comes in a PHQ-2 and a PHQ-9. For some reason, we always do the 9. But if the 2 is negative, then the 9 doesn't matter. But the PHQ-2, if you will, are just 2 simple screening questions. And the first one is and everything's the last 2 weeks. So in the last 2 weeks, have you felt down, depressed, or hopeless? Okay. And then it's not like, you have to be severe. It's, not at all. Some of the days, more than half the days, almost every day. Those are your options. So it definitely grades severity. And then the second question is, in the last 2 weeks, have you had decreased interest, lack of pleasure, things that you would normally enjoy doing? So, if you're someone who really enjoys doing puzzles, in the last few weeks, you just kind of like, okay. And that's just an example. Okay. It could be anything. Then if you answer yes to either of those questions, then you would go on to complete the rest of the questionnaire, which includes things like focus, being fidgety and restless, feeling down about yourself, feeling like you're a failure. The question, poor appetite, sleeping issues, eating too much. Those are questions we ask everybody. So and you don't need a lot of points. You need like 5. Okay, and you can score, if I remember correctly, up to 30. If you get 30, then we got a really big problem. So you don't have to have a lot to qualify. Anxiety, I find, overlaps a lot of patients with depression and vice versa. And it doesn't have to be severe. Okay, so mental health is very broad. Now, the challenge here is that patients who have mental health issues, who have issues with depression and anxiety, because of poor motivation, because they tend to feel isolated, because they don't feel that everybody understands them, tend to do things like not seek care. Okay, because they don't understand, they think, oh, the doctor's not going to help. Okay, or unfortunately there is a bias where I think that, I hope it's not a lot of doctors, but I'm sure it happens. I'm sure I've been guilty of it, where you have someone that's struggling with depression and some of their symptoms of depression may actually be because of other issues. So you can have a diagnosis bias and actually misdiagnose a patient because of it. Now, I'm not telling you that to not trust your physician, but to make sure that your physician is aware of all your symptoms, so that, and that everything's appropriately explored. Okay, because we don't want to just assume. You know what happens when we assume, right? So not good things. So those are kind of the negatives. In terms of your physical health, not only do you maybe not get everything you need, maybe you don't get all your screening tests done because you don't feel like going. Maybe it's just a matter of feeling like getting up and taking care of yourself. All right, that's a problem. You need to be able to get up and take care of yourself. You need to find value where there is value, because you are valuable. Everybody has value. You know, I haven't talked a whole lot about faith on here, but the reality is that, you know, I do talk about that we go to church, my family, my husband and I, and we are born again Christians. And we do believe that our worth comes from our relationship with Christ. You know, we're created. So if we were created with a purpose. If we were created with a purpose, then we have value. All right. It's intrinsic value. Nobody can take that away. No one can, you know, give that to you. No, it's not earned. Okay. So if you have value, then you need to figure out, how do you see that? How can you understand that? How can you take that to heart and personalize it for you? So I would strongly encourage, if you're someone who's struggling with these things, that you reach out, get some help. Counseling's great. Medication, if you need it, is okay. I know that there's a lot of negative Nancy's out there about medicine, but the reality is, I look at medicine as giving yourself a bigger pot. If you're always boiling over, you just need a bigger pot. It doesn't have to be something you do forever either. Your doctor and you can work on a plan, 3, 6 months, 9 months, whatever it needs to be. But talk to your doctor about that, because not every medication works the same and not every medicine is for everybody. So there's definitely a game plan that has to be made in that situation. I will tell you, natural mood elevators, sunshine, okay, getting outside, even if it's just like 10-15 minutes a day, especially in the morning, huge help. Make sure you're getting enough sleep. Okay, if you're not getting enough sleep, I don't care how optimistic you are, the world will always be, your glass will always be half empty, period. Okay. 3, you need to make sure that you are fueling your body appropriately. Now, this goes back to motivation, and if you're not enjoying things, if you don't feel like taking care of yourself, that's a challenge. But truthfully, if you put a bunch of junk in your body, you're going to feel like junk. Okay. And if you feel like junk, it's certainly not going to help your mental state. So try and pick well-balanced foods, pick, you know, whole foods, your veggies, your meats, those kinds of things. If you do a lot of carbs, do your whole grains, rice, quinoa, potatoes, you know, real food. Okay. Not a bunch of processed garbage. So sunshine, sleep, get your good food, and then get some exercise. Now, yes, if you don't feel like doing exercise, I get it. Okay. I really do. When I started my changeover here 3 years ago, the idea of working out was just beyond my mental state. Okay. I was tired. I was depressed. I had a lot of anxiety. I knew something needed to change, but I was not mentally capable of handling all of it at one time. Just wasn't going to happen. Okay. Sorry. So I decided I was going to focus on the eating component and focus on my sleep. All right. And then as my sleep and my eating caught up with my mood, and my mood started getting a little better, my energy started getting better, that's when I decided to start getting some exercise. So if you're at a point where you're not even able to wrap your head around going for a walk, fine. Just start with like 10 to 15 minutes of sunshine a day. Okay. That's getting out of your house. That is it. Okay. So, and when you feel like you're at a point where you can do a little more, it doesn't have to be an event, right? So go for a walk, go for a 2-minute walk, go down the block and back, walk around your complex, whatever gets you moving. It doesn't have to be giant. Okay. You can grow, you can progress as time goes on. You do not have to be running a marathon out of the gate. I will never run a marathon. Just going to throw that out there. My knees are bad. And honestly, I just don't like running that much. It's not my thing. Okay. So like, I legitimately run a little bit in the mornings with the dogs because I know it tires them out, not because I'm dying to run. Okay. So, but exercise will help your mood. Okay. It helps you sleep better. It helps get some of that excess energy off, helps with the anxiety. It does help with your depression. It creates natural endorphins. So those endorphins are basically like your natural morphine. That helps your mood. Okay. So there is a role for exercise, but I don't want you to feel like I don't want you to get overwhelmed trying to do it all, because that's horrible, and you're not going to be successful doing that. And I do not want discouragement. I want success. I want to see you progress, and I want you to be able to do what you can. So we talked about the things that will help your mood. Honestly, depression, we know, affects other health disorders. Okay. I can tell you that high anxiety will make people's blood sugars worse. We know it does. Cortisol screws all kinds of stuff up. Okay. We know that patients with heart disease who have depression actually have a higher risk of having more heart attacks. Okay. And that has to do with serotonin and platelets and all that jazz I'm not going to bore you with. Okay. But there's actually data out there that supports using selective serotonin reuptake inhibitors, and that's like your Zolofts and those kinds of things, in patients with heart disease, because of their effects on platelets and how it reduces their chance of repeat events. Okay. So, and those are just a couple examples. All right. We're running out of time, but I want you to understand your mental health, your physical health, they overlap dramatically. And if you need help, please, please, please reach out. If nothing else, shoot me a message. Okay. I'm happy to field any questions or help point you in the right direction if I can. But ask for help. Okay. People do want to help you. I know sometimes if you're in a deep, dark hole, you don't think people do. And that's just an absolute lie. Okay. We don't want you to believe a lie. There is always someone who wants to help you. And there is always someone who's willing to reach out a hand and help you. You have to be willing to take that person's hand, though. You have to be willing to reach for the help. Okay. So that's my take home today. Have a wonderful Monday. Let's finish the week strong. It's the end of school. Let's get through May. And then you guys, we have a 3-day weekend coming up. How awesome is that? So have a wonderful day, y'all.